Hi all, today we are going to discuss about preventive psychiatry. I am sure that already you have studied in first year BSc nursing regarding prevention of disease or prevention of illness and levels of prevention. When we come to mental health nursing, again we will study about the preventive aspects in psychiatric nursing and classification. So here we are going to focus on the classification proposed by Caplan and one more classification proposed by Jordan. So it is not vast, very easy to understand, and you will be learning it fast. Okay, so today let's start our section once again. Welcome back to today's class. So we'll move on to the first slide, that is a definition of preventive psychiatry. It is same as prevention of disease or prevention of illness, only we are applying the mental health aspects. Okay, so preventive psychiatry is a branch of psychiatry that aims at health promotion, protection from specific mental illness, early diagnosis, effective treatment, disability limitation and rehabilitation. Okay, please note the point: health promotion, protection from specific mental illness, early diagnosis, effective treatment, disability limitation and rehabilitation. Okay, I have told you in the introductory part that we are going to focus on two types of classification proposed by Caplan and Jordan. Okay, first we'll focus on Caplan's classification of prevention in mental health. So he has classified into three, that is primary, secondary and tertiary, which is very easy for you to remember. So according to Caplan, primary prevention focus on prevention of mental disorders before they occur. So it aims to reduce the number of new cases. Strategies are decrease risk factors, increase protective factors. For example, like to prevent substance abuse disorders, complications, many awareness programs are being conducted in school level, college level, in occupational level, etc. So that is an example for primary prevention, where it focuses on prevention of mental disorders. So some of the interventions like nutrition and healthcare, addressing housing and homeless issues, prevention and care of child abuse, family support, social mental health programs, personal skill development programs, protection of youth from negative consequences of parental divorce. These are some of the examples. And when we come to the secondary prevention, it focuses on detecting mental disorders early in order to intervene promptly. So, diagnosing the mental health disorders to provide appropriate intervention, that we are going to focus in the secondary prevention. That is why we have to focus on, why we are concentrating on secondary prevention, why we are diagnosing it, to reduce the prevalence of mental illness and to reduce the duration through early diagnosis and holistic treatment. That is, it focuses on two main strategies: early detection and appropriate treatment. Okay, so some examples are like screening programs, early diagnosing and finding out the cases, referring to higher centers, effective treatment, and at the same time educating the healthcare professionals in providing mental health care, then providing consultation service like in primary health care, then district hospital, then later we are referring to higher centers. Okay, then crisis intervention. Okay, then according to a need-based intervention. So these are some of the interventions that we focus on secondary prevention. Hope you have understood the difference between primary and secondary. Primary means prevention of mental disorders before they occur, and in secondary we are focusing on diagnosing the mental disorder to reduce the further conflict. Okay, third one is tertiary prevention. So it focuses on interventions that reduce disability, enhance rehabilitation, prevent relapse and recurrence of illness. Okay, in simple way, it focuses on providing interventions, reducing the disability and providing rehabilitative care. Okay, so to reduce the severity of the illness, okay, it can cause self-harm, especially in mental illness, or sometimes it can cause violence for others. Okay, we have to reduce, and we have at the same time we are reducing the disability, discomfort and complications. Okay, because of mental illness. So the main strategy from the definition itself we can frame like it is promote recovery and prevention of complications. Okay, for recovering, making the patient recover from particular situation and at the same time to prevent the complications. So some of the interventions examples are vocational activities, recreational activities, rehabilitative service, training on adaptive coping skills, behavioral interventions, family focused therapy, involvement in some of the alcohol anonymous groups and other self-help groups. So usually these kind of patients you will be receiving in psychiatric setup, or when you work as a psychiatric nurse you will be seeing these kind of patients, and these are some of the intervention, especially when the patient is in tertiary level. We have to focus on specific interventions like rehabilitative services to support the patient's living, including work, family and social interaction. We have to train them at coping skills. Behavioral interventions have to be focused, psychotherapy, psychoeducation, family focused therapy, and involving the patient in alcohol anonymous groups, etc. So this is very important. These are the three aspects of classification when it comes to Caplan, that is primary, secondary and tertiary. Hope you have understood. So second classification is the classification proposed by Jordan. Okay, so Jordan in the year 1983 proposed threefold classification of primary prevention interventions, that is universal, selective and indicated prevention. So already we have seen what is primary prevention. So in the primary prevention there was some of the interventions we focused was nutrition and healthcare, addressing housing and homeless issues, prevention of care of child abuse, family support, school mental health program, personal skill development. The strategy was to decrease the risk factors and increase protective factors. That was the main classification. That what was the main strategies we have seen in Jordan in Caplan's classification. So now we are going in detail about the primary interventions. What are the in detail aspects, what are the classification of primary prevention interventions? That is, he has classified into threefold classification. Okay, Jordan's threefold classification of preventive psychiatry. So here the first one is universal prevention. Universal prevention. So by hearing that particular word, universal prevention, so it is defined as those interventions that are targeted at the general public. Universal, it is focused or targeted universally, that is the general public, who or a whole population group that has not been identified on the basis of individual risk. It addresses genetic risk and protective factors in the general population. So the universal prevention in primary level focus on the whole population with addressing the general risk factors and protective factors. Examples, or it focus on promotion of well-being, that is social and emotional competence. Okay, promotion of well-being of the whole population, development of relationship, resilience, mental health education, stigma reduction, safe, active and positive school climate, school and emotional learning. Okay, it focus on the general population, that it focus on school students, college students, stigma reduction, because everywhere those patients who are having mental health issues, the family may hide, the particular friends, everyone will hide. So to reduce that stigma, or the society is having a negative stigma or negative thought about mental illness, to reduce that, and educating to develop a good interpersonal relationship, and to focus on social and emotional competence. That is the universal prevention. Selective prevention, so it targets individuals or subgroups of the population whose risk of developing a mental disorder is significantly higher than average, as evidenced by biological, psychological or social risk factors. Okay, selective prevention. Universal prevention, we told the whole population is included. In selective population, some target individuals or subgroups, okay, so who are at risk of developing mental disorder. For example, socio-economically disadvantaged population, for example migrants, they will be having their own problems, emotional problems, victims of disaster with post-traumatic stress disorder, then destitutes, they will be having emotional problems, no one will be there to support them, to care them. homeless and unemployed population. So these people need special attention or special intervention. So that is an example for selective prevention areas. And at the same time, patients with those who are having stressful life events, family conflict, racial injustice. Okay, so these selective interventions, what we focus, the strategies involved are dealing with emotional problems. The strategies are dealing with emotional problems and promote resilience. That means to promote recovery. Okay, these are the two strategies that we focus in selective prevention. And so those who need the care, we need to provide early, we have to facilitate early identification based on their need. Okay, that is about selective prevention. Hope you have understood the difference between universal and selective. And the last one, according to Jordan, is indicated prevention. So the indicated prevention targets high risk people identified as having minimal but detectable signs and symptoms foreshadowing mental disorders or biomarkers indicating the predisposition of mental disorders but not meeting diagnostic criteria. So indicated prevention means, like, once you focus, you may come to know that this particular group there is a chance for developing mental illness, okay, because of some of the predisposing factor, because of some of the precipitating factor, or shadowing mental disorder or biomarkers indicating for mental disorders, but they may not be been diagnosed with particular mental disorders. So it focuses like the individuals showing subthreshold manifestation of mental disorders. For example, some of the patients who are showing like suspiciousness, then at the same time those who are having panic anxiety disorder, those who are having hallucinatory thoughts, okay, by listening to the people with different personality disorder. Okay, those people, we will be targeting on those people for providing indicated prevention strategies. And having genetic predisposition, family history of psychiatric illness, that is the best example. The patient, the family who is having history of psychiatric illness, we can focus on them. Okay, then those who are with abusing of alcohol and other drugs and with certain personality types. So these are the target group that we focus on indicated. So once again, I will tell, in universal we focus on the whole population. In selective we focus on particular group, okay, who needs special intervention. So like the college teens who are having some of the psychological approaches problems, we will be focusing like that. The destitutes we will be treating like providing special interventions. Those with disaster victims will provide appropriate interventions. That is selective. The indicator, we will focus on the history. If the family is having history or continuous psychiatric illness, we can provide particular aspects in the primary level itself. So Jordan's classification focus on the primary level. In that, certain interventions are being provided based on the need. So when we are concluding, we can tell preventive psychiatry or preventive strategies have been found to be effective in reducing incidence and disability in wide range of mental illness like psychosis, depression, anxiety. So the preventive strategies in mental health practice are reducing exposure to aggravating factors and helping the patient to strengthen their coping mechanism to tackle situation effectively. So being a nurse, the main role is to reduce the exposure of aggravating factors and helping the patients to strengthen their coping mechanism by participating in preventive, secondary and tertiary prevention. Thank you. Hope you have understood.